few episodes on, we had a patient that was in the ICU, was intubated, and experienced delirium. She shared her experience where the healthcare system lacked support emotionally and psychologically. And again, it's very multi-factor. You come into the show and you bring up the gap that we don't have culturally. And if you were to kind of take a shot at it, maybe throw a dart at the wall to see how we could potentially fix this, because ultimately it affects the patient care rate, and the front line is the hospital healthcare system. That's where most people go. They see this gap culturally. So how can we bridge that gap where we're more culturally sensitive, if you were to take a shot at it any kind of way?
Yeah, I think from a high level, like healthcare system, there's value to autonomy and self-determination of having a pot of resources saying, hey, your community is here. You know best of how to care for the community. We'll support you. And here are some resources and money to build clinics the way you want, build healthcare with indigenous forms of healing. When I say that, people hold traditions of healing within their cultures that they want to bring into health as well. So incorporating that and creating a system that works for you, and we're here to support you, right? If you don't have to build your own hospital, we'll make sure we work with you. So there's a way to do that as big systems. I think at the individual level, we could all benefit from more education too. When I say that, people sometimes get overwhelmed. They're like, wow, like how many communities are there? How many cultures? How many countries? How am I supposed to learn it all? And I try to pause people there, because often in your neighborhood or the hospital that you're a part of, there's a handful of communities. Even in the most diverse communities, there might be 30 or 40. We've memorized so many things in medicine and rare diseases and protocols. This should not be something that seems daunting to you. Understanding the communities that are in your neighborhood, especially its hospital system, and what matters to them, and how can we change our relationships to them. The last point that I'll make is I've been deep into thinking about how people are critical of our healthcare systems, right? And I don't know if you've heard of Victoria Sweet. She wrote God's Hotel and Soul Medicine. I think that's her newest book. And I think the other book that I was reading was Victor Montori, which is Why We Revolt. And I'm trying to incorporate how people who are really knowledgeable about the system envision a different future. And one thing that always comes out, which seems so obvious, is making healthcare slower, which is 15-minute visits here. And I know both I've done and traveled are saying, there's so much time pressure because they're expecting productivity, want efficiency and resource constraints, but making things slow down and helping patients be seen for who they are goes a long way too. Because culture is just one part of it, right? I'm Indian, but there's so many different kinds of Indians, and me as an Indian is only part of my identity, and you wouldn't really know that until you know me. And most systems right now, or the ways they're set up, are designed to know people well.